Good evening to everyone. Welcome to today's wonderful evening with Dr. Murali Bharadwaj. So, what is the strategy to win any entrance exam, whether it is INICET or NEETPG or FMGE? There is only one strategy you should know. And what is the role of the coaching program, coaching guru, or a coaching center, whether it's live or online or offline or videos? What is the ultimate goal? If you look at NEETPG, it is not an exam of today or yesterday. NEETPG had been conducted for almost a decade, and there are about 10,000 PYQs hai bachcho, 10,000 PYQs. We need to at least one time do the revision of these 10,000 PYQs. Then what is the second important thing? FMGE, don't underestimate it. FMGE is the twin sister of NEETPG. Down the line, they are saying next exam is going to wipe out all these exams, but questions remain the same, topics remain the same, items which are tested remain the same. So there are 6,000 PYQs. Then INICET and AIMS, a real brainy exam with clinical case vignettes type of questions, proper image-based questions. So if you look at the INICET, there are totally 6,000 PYQs in INICET. So pura kitna ho gaya? 6,000 plus 6,000 plus 10,000. 22,000 PYQs. A lot of times we think, let us study the theory very well and then start doing the practice of this PYQs in the last moment. No. The right strategy is do the PYQs first. Know what examiner wants and strengthen the areas where you are weaker. Very easy to do that. So this 22,000 PYQs, I converted them into single liners, right? So for example, what is the investigation of choice for detecting aortic aneurysm? Let's say ultrasound abdomen is the best screening test. So there may be other options, CT scan, etc., etc. But you don't need to know all those things. It's very clumsy. You know, ultrasound is the investigation of choice as a screening test for aortic aneurysm, bus, more than enough. So I converted all of them into single liners. And these single liners I have presented, this 22,000 PYQs, which are the single liners, मैंने बनाया ट्वीट बुक्स के फॉर्मेट में. ये 22,000 PYQs को अगर आप मास्टर किए तो done, you are ready for the exam. So what I will do is every day I will discuss 150 PYQs in 1 hour. In 1 hour. Just follow me on the YouTube, and within about 150 hours, we finish all these 22,000 PYQs. And you don't need anything else. This is the mother of all information that you need to master for the NEETPG exam. All right? A lot of things that you prepare for the NEETPG or INICET or FMGE, after the entrance, they are useless. Let me tell you. For example, in forensic medicine, you read so many sections. In preventive medicine, you read a lot of biostatistics. To treat the patient tomorrow, you don't need all this. But for entrance exam, we need to know. So that is the reason you should know what is that 10% of the textbook that you need to study to answer 90% of the questions in the tomorrow's exam. Otherwise, you can say, what is the 20% of the textbook that you need to focus to answer 90% of the question paper correctly? So that is the funda behind answering PYQs. Very nice to see Tintin and many more. So please punch whether the voice loud and clear for all of you. And each of this session, after the session is over, we will delete the video and you will get the video on the web. But what I want you is participate in a live session. You have a live teacher, digital board. Wow, that's a great sensation. So every day, at least 1 to 1.5 hours, हम 22,000 PYQs के ऊपर ध्यान देंगे और 150 hours में 22,000 PYQs का revision करेंगे. That is all that you need, Dr. Murali Bharadwaj, your classmate, roommate, benchmate, tablemate, to make you the topper in every entrance exam. So शुरू करेंगे? Yes. So let's start with FMGE PYQ question bank. So this is a question from the July 2023. Lingual nerve damage causes the loss of the sensation of the tongue in which location? Anterior 2/3 of the tongue, there is a loss of the sensation. So the muscle supply, nerve supply of the supplied by for the tongue, you should be very, very sure about. Now, doctor, membranous urethra injury, what will lead to? It will lead to the collection of the urine in the anterior abdominal wall. So once more, you have a membranous urethra, prostatic urethra, right? Penile urethra, bulbar urethra. So you should know. So what time do you conduct these sessions every day? Sir, typically morning I'll be very busy with the hospital. So I'm a MD general medicine, practicing intensive care physician. I also do home visits to the elderly people to take care of them in Hyderabad. So definitely in the evening, sometimes if I am able to come back from the hospital by 6 o'clock, we'll have a session at 6. Sometimes at 7, 8 or 9. Some days are very busy days for a physician. So at least 1 hour before I go to sleep, I'll spend time with you. And early morning hours, once more, Brahma Muhurat, you will have a lot of energy levels. 6 o'clock or 7 o'clock, I'll try to conduct the session. So you have our helpline number, which is being given below in this video. You can give a call and subscribe to the program. So doctor, thoracocentesis, where do you want to do the thoracocentesis? So it is the upper border of the lower rib, upper border. Because agar aap rib liye to, if you happen to take any rib, let's go to this. If you take any rib, so you have the sternum. So the neurovascular bundle, it typically passes along the lower border. For example, if this is the rib, lower border of the rib. That's the reason if you put the needle along the lower border of the rib, you are bound to injure the neurovascular bundle. That's the reason you'll be passing the needle through the upper border of the rib is what you need to basically remember. So doctor, that is the funda. Now, prepatellar bursitis. Prepatellar bursitis, housemaid's knee, it is called as. It is typically lead to pain and swelling at the knee joint is what you need to basically remember. Now, after the delivery, a woman developed the pain which is radiating along the anterolateral thigh. So it is also called meralgia peristhetica, which is typically the feature whenever the lateral femoral cutaneous nerve damage is there, is what you need to remember. Now, coming to the facial nerve. Facial nerve typically supplies the eyelids. For you to close the eyelids, you require facial nerve supply, because all the part of the face motor supply is by the facial nerve, except the levator palpebrae superioris, which lifts your eyelid, is supplied by the oculomotor nerve. That's the reason oculomotor nerve palsy lead to weakness of the levator palpebrae superioris, which lead to drooping of the eyelid and ptosis is what you need to basically remember. So, whenever facial nerve damage is there, the problem is inability to close the eye and difficulty to eat, because for difficulty for the eating, you require orbicularis, oris, etc. And your both angles of the mouth should be well aligned, which is lost in facial nerve palsy. So that is the reason facial nerve palsy lead to inability to close the eyelids. Oculomotor nerve palsy leads to inability to open the eyelid. Opposite. Because oculomotor nerve supplies the levator palparis superioris, whereas the facial nerve supplies the orbicularis oculi. That's the reason there is a drooping of, there is an inability to close the eyelid, exposure keratitis. That's the reason facial nerve palsy patients mein kya karoge? Will put the teardrops to keep the eye wet, is what you have to remember. So when will thallus bone ossify? Is one of the favorite questions of the examiner. So this is a purely batti marne wala item hai. 6 months of the intrauterine life, thallus bone ossifies is what you should remember. Now, in the brain, if you look at the paracentral lobule. So let's go back to the brain, the motor area of the brain. So this is how the cerebral hemisphere is located. So this area is called paracentral lobule. So if you look at the homunculus, the mapping of the motor area of the human body, typically you see the leg area will be hanging along the paracentral lobule area. So this paracentral lobule area is supplied by anterior cerebral artery. That's the reason whenever anterior cerebral artery occlusion is there, what will happen? Contralateral lower limb monoparesis. Contralateral lower limb monoparesis. That is, the right anterior cerebral artery stroke will lead to left lower limb, lower leg monoparesis. The patient will be dragging and walking, dragging his leg and walking in anterior cerebral artery stroke, which supplies the paracentral lobule in the motor area, which typically supplies the contralateral lower limb, is what you need to basically remember. So hard worker is saying, sir, I like your teaching efforts and the way of revision, sir. Definitely. Because I had been a poor student, which made me to become the best teacher. Always a poor student is the best teacher. अगर एंट्रेंस क्लियर करना बहुत मुश्किल हो रहा है, मुश्किल ही नहीं नामुमकिन हो रहा है, that is the time where the real teacher will be born out of you. How to make it easy for others to pass, right, doctor? Now, of course, during my time I was the topper, first ranker, but to become first ranker, there had been a lot of effort involved. It did not come so natural for me. If somebody said I became a topper naturally, a lot of my students say, really they are blessed and gifted, right? Now, doctor, left gluteus medius and minimus paralysis. What will it lead to? The medius and minimus, gluteus medius and minimus, not maximus. They both will cause the opposite side pelvis from drooping down. So if there is any weakness, the other side pelvis will start drooping down. That's what you need to remember, which is called Trendelenburg sign positivity. So once more, let me explain you this. So let us say this is your pelvis, right? And this side gluteus, medius and minimus, not maximus, medius and minimus. What will they do? They will typically pull this, that is abduct this side of the pelvis, so that if this side is unsupported to gravity, right? Obviously, when it is unsupported, suppose that side leg is unsupported, it has a tendency to be pulled down by the gravitational power of the earth. But that is being prevented by this side pulling effect. It will pull back. But if it is weak, what will happen? This unsupported side will sink down, which is called Trendelenburg positivity, is what you need to remember. The reason left gluteus medius minimus weakness will lead to the pelvis to sink towards the contralateral side. That is towards the right side is what you need to basically remember. Now, doctor, assisted the anterior border of the sternocleidomastoid. What is it because of? It is due to the persistence of the second branchial arch, is what you have to emphatically remember for the tomorrow's exam. So what is the most common site of the clavicle fracture, doctor? It is the junction of the medial 2/3 to that of the lateral 1/3 is the most common location of the fracture of the clavicle. You have to remember, right, doctor? It is purely how you remember. So whenever there is a frozen shoulder, so where do you get frozen shoulder? Frozen shoulder whenever there's a diabetes, right? So abduction movement of the joint is the one which is compromised. So a guy who has a frozen shoulder, you ask him to abduct and catch something, he cannot. So it is the abduction movement which is compromised is what you need to remember. So examiner will give so many options. Is it adduction, right? Is it supination? Is it pronation? So many things. But if you know it is the abduction which is compromised whenever there is any frozen shoulder is what you have to remember. The pulse of the posterior tibial artery. So what are the two bony areas or surface landmarks where you will feel for the posterior tibial artery? It is between the medial malleolus and the medial border of the tendocalcaneus in inversion, where you feel the posterior tibial artery is what you have to remember. So this also will come as a image-based question. How do you feel the posterior tibial artery? You need to be very, very sure about. Now, the vertebral levels, one of the favorite area, doctor. So every MCQ in the PYQs, I converted them into a single liner, classified into which topic they belong to. And you get all these notes as a PDF directly mailed to you. And just to finish this 22,000 PYQs in 150 hours along with me. But any entrance you will crack the top rank. Right, doctor? Now, so a vertebral level, L2 में क्या होता, L3 में क्या होता, T7 में क्या होगा, T4 में क्या होगा, all these vertebral levels, their anatomical landmarks, every damn entrance book has got that. You need to master because this is one favorite area of examiner. Whenever there is any unilateral hypoglossal nerve gives the motor supply of the tongue. So the tongue deviates to the ipsilateral side. This is very important to remember, doctor. So, आपका tongue ऐसा है, right? So, suppose if this side hypoglossal nerve is damaged, then all the tongue muscles motor supply comes from the hypoglossal. The tongue get deviated to ipsilateral side, same side. Why? The other side, which is well innervated, will try to push the tongue towards the weakened side. So that is the reason the tongue will deviate ipsilateral to the side of the hypoglossal nerve palsy is what you have to favorably remember for the tomorrow's exam. So how does knowing brachial arch affect the diagnosis and treatment set? Good question. So fundamentally, the branchial arch derivatives are the ones which give a lot of adult structures. So whenever there is any congenital abnormality of this branchial arch derivatives, embryologically you should know from which branchial arch they have derived from. So next, spinal cord. In the newborn, spinal cord where does it terminate, and in adult, where does it terminate? In case of the newborn, it terminates a little lower level, that is at the level of the L3 is what you should remember. Whereas in the case of the adults, it is at the level of the L1 is what you have to remember. Now, posterior cricoarytenoid muscle. So what is its function, doctor? Posterior cricoarytenoid is an abductor of the vocal cords is what you have to basically remember. Now, corticospinal tract, it is also called pyramidal tract. So where does it cross? It crosses at the level of the lower medulla is what you need to remember. So once more, doctor, you should know. So you have the cerebral cortex, right? So from the pyramidal cells of beds, the corticospinal tract will start. So the corticospinal tract fibers will descend down. They form a thin ribbon strip which is called internal capsule. Surrounding that you are having the basal ganglia, you are having islands of gray matter which is called basal ganglia. So it continues down. Then you are having the brainstem. So brainstem में क्या होता है? Midbrain, pons, medulla. So it passes through medulla, midbrain, pons and medulla. Once it reaches to the lower part of the medulla, there it will decussate to opposite side. So from there, how is its journey? So typically in the brainstem, right, it will be passing through the midbrain, pons and medulla, reach the contralateral. Typically it will decussate at the lower part of the medulla. It descends down, and here in the spinal cord you are having anterior horn cell. So it will come and end in anterior horn cell. So from the cerebral cortex through the internal capsule, through the midbrain, pons and medulla, then decussates and goes to the contralateral side, and in the spinal cord end in the contralateral spinal cord. So this entire tract is called as corticospinal tract. Corticospinal tract is what you need to remember. It is also called pyramidal tract because the cells are originating from the pyramidal cells of beds. So that is the reason whenever a guy is having paralysis, let's say on the right side, then he will have the weakness on the left side is what you need to remember. So if the corticospinal tract is called as pyramidal tract, what is extrapyramidal tract, doctor? What is extrapyramidal? These anterhorn cells, which are the motor controllers of all our muscular activity, typically are controlled also by three tracts: vestibulospinal tract, rubrospinal tract, reticulospinal tract, and tectospinal tract. और एक बार मेरे साथ बोलो, vestibulospinal tract. Where are vestibular nerves located? So you should know 3rd, 4th in midbrain, 5th, 6th, 7th cranial nerves in pons, 8th, 9th, 10th, everything in medulla. So your vestibular nuclei are located in medulla. From there also there is a control of the anterhorn cells. They are called vestibulospinal. Reticular formation of the midbrain and pons will also control the anterhorn cell. इसको बोलते हैं reticulospinal tract. Red nucleus near midbrain, it also controls the anterhorn cell. इसको बोलते हैं rubrospinal, right? Tectum is the roof. So tectospinal also controls. So these four tracts, vestibulospinal, rubrospinal, reticulospinal, tectospinal, these four tracts are called extrapyramidal tracts, which lead to rigidity. Whenever they get affected, there is a resistance to the movement of the joint throughout the movement of the joint. Whereas if the corticospinal tract get affected, then there is a spasticity. That is, initially there is a resistance and after that it is giving up, called clasp knife type of resistance. Is the feature of pyramidal tract lesion. This is what you need to understand. Simple things. God lies in simple things, doctor, which you need to have the clarity when you go for the NEETPG exam. Killian's dehiscence, where do you see? Between two muscles, cricopharyngeus, thyropharyngeus. Between the two, you find the Killian's dehiscence. Now, what are the paired cartilages in the larynx? Arytenoid, corniculate, cuneiform. These three are called paired cartilages when it comes to the larynx, is what you need to remember. So, doctor, can you please punch? Is the voice loud and clear? Are you able to see the letters in the slides? Of course, the teacher. I hate to sit before that computer and then keep teaching. That doesn't look natural. That's the reason I took this digital board, which is more natural, like a live class where you can move around and you can write on the board, easy to understand for you also, right? Please give a feedback. Did you like this? Did you like this method? Is the voice loud and clear? Now, bulbar urethra injury, what does it lead to? So earlier we have seen membranous urethra injury, which lead to leakage of the urine into the anterior abdominal wall. So now, bulbar urethra injury causes the urine to leak into the superficial perineal pouch and the scrotum and into the thigh, is what you need to remember. The fetal midgut. So the rotation of the gut is the favorite area of the examiner, doctor, in the embryology. You need to be very sure. I'll also give you the notes, right? There are about 70,000 high-yield facts as single liners that you need to master from the 20 subjects. I'll provide it as a note to you. So make sure. So you should also know, I'll take you to the browser. So please take an opportunity to go to playscore.live, playscore.live. So here you will find we have three things to offer. One is called the video library containing about 5,000 short videos, 400 hours of video library covering the 20 subjects. It is available any day. Of course, so many people are offering video library, it's no big deal. Then NEETPG mock test. Every Friday, Saturday, there is a subject-wise mock test according to a schedule along with the discussion. Every Sunday, there is a full-scale mock test with 200 MCQs, just like the actual NEETPG exam, with around 40 to 50 image-based questions and discussion. So that we offer. Then we also offer the notes. So each of them cost you a small amount of 6,000 rupees, right? So take every opportunity to visit playscore.live. In addition to this, we will also conduct a free YouTube live session doing the revision of 22,000 PYQs. But after the session is over, we will back up this video on our web portal, and we will give you an access for you to do the revision if you happen to miss the class once you subscribe. Right, doctor? So these are our helpline numbers, and some of the times we broadcast directly onto the web itself, onto the playscore.live. So take every opportunity to do the revision. So fetal midgut, it rotates 270 degrees anti-clockwise in the intrauterine life. How will you remember clockwise or anti-clockwise in tomorrow's life? Fetus maneto, teenaged. Teenaged guy will be rebellion. No, you are wrong, daddy. The teenager will tell. So anti. So anti-clockwise rotation will be the fetal midgut by 270 degrees is what you have to basically remember. Now, around which blood vessel does the midgut rotate is a favorite question. It is the superior mesenteric artery around which the midgut will be rotating in the fetal life is what you need to remember. So what is the muscle that leads to retraction of the scapula? It is the trapezius. It is the trapezius muscle, which is the retractor of the scapula. So these are all based upon the FMGE PYQs. 6000 FMGE PYQs खेलते रिविजन करेंगे. उसके बाद 10,000 PYQs from NEETPG खत्म करेंगे. Then 6,000 PYQs from INICET खत्म करेंगे. बस अगर कल के NEETPG INICET FMGE ये 22,000 PYQs से 100% निकलेगा, at least you will get the idea how to attack the exam once you solve this 22,000 PYQs, right? So some of them are straight facts. They don't require any explanation, but you require at least to know them once. For God's sake, once in life, when you go to the exam without keeping an innocent face there. So the fracture of the upper radius and ulna typically affects which movement? Is it supination or pronation? It typically affects the pronation movement. What is pronation, doctor? Pressing with your finger is pronation. Supinate, drinking the soup is supination. So supination, pronation, supination, pronation. So the pronation movement is the one which is affected if typically there is a fracture of the upper radius and ulna is what you need to remember. Now, biceps femoris in the lower limb is supplied by, it is the tibial nerve and the common peroneal nerve. They are the ones which supply the biceps femoris. Now, there is a adductor brevis. What is the nerve supply of adductor brevis is a favorite question. Obturator nerve is the one which supplies the adductor brevis. So one question definitely comes from one of the nerve supplies, doctor, you need to be very, very sure about. Peroneus longus, what is the function of it? Everter of the foot and inverters of the foot you should know. Peroneus longus is a everter of the foot. So once more, its nerve supply. Definitely it is there in the question bank of NEETPG examiner, means every NEETPG it will come. So you should know peroneus longus, peroneus brevis, what is their nerve supply. Now, where is azygous vein? Typically on the, if you look at the surface of the lung, there is a mediastinal surface. So it is the mediastinal surface of the right lung where azygous vein is present. So if you look at the markings, right, doc? So if you look at the markings of the lung, then on the right lung, mediastinal surface, right? So there is one intercostal surface, mediastinal surface. So on the mediastinal surface of the right lung, not left lung, right lung, where you have the azygous vein is what you need to remember. Once more, doctor, for the tomorrow's NEETPG exam, you should know thoracic duct, azygous vein, how does it form, what is cisterna chyli. All these are the high yield areas for the NEETPG exam. So, doctor, left gastroepiploic artery. So, all the branches of the celiac trunk, you need to be very sure. One of the favorite areas of the examiner, left gastroepiploic artery is the branch of the celiac artery is what you have to remember. So, once more, if you go back to the notes, you see every entrance exam they will ask about superior mesenteric artery, inferior mesenteric artery. Similarly, the celiac trunk, abdominal aorta, what are the branches? One vascular question, inevitable. Tail of the pancreas, where is it located, doctor? Splenorenal ligament. It is present in the splenorenal ligament is what you should remember. Sternum is attached to the sternum and scapula. They both are connected by clavicle, the collarbone. Very simple question. Vasa brevia. What is vasa brevia? Those short gastric arteries, right? The short gastric arteries typically are also called vasa brevia. Mandibular branch of the facial nerve. So, facial nerve has, what are the 5 things? Temporal, buccal, mandibular, zygomatic and cervical. इसको बोलते हैं pessancerinus. और एक बार बोलो, temporal, mandibular, buccal, zygomatic and cervical, right? So, mandibular branch of the facial nerve is the one which supplies the muscles of the lower lip is what you need to remember. It is a labial artery which supplies the lower lip. So, lower lip is a favorite hot spot for the examiner. Tragal pointer is a landmark of the facial nerve on the parotid gland. That's the reason parotid gland surgeries have a great risk of causing an injury to the facial nerve is what you need to remember. It is a medial pterygoid muscle spasm that lead to trismus. So you have a medial pterygoid, lateral pterygoid, which is the opener, which is the closer of the mouth, you should know. So it is the spasm of the medial pterygoid muscle which closes the mouth is responsible for the trismus is what you have to remember. Then buccinata is an accessory muscle of mastication. You can chew better with a buccinator. Parotid gland, where does it open, doctor? It opens into the second maxillary molar is the area where parotid duct will be opening into. So what is mammillary body? Mammillary body is important for all our memory. Mammillary body is the part of our Pepys circuit. Right, doctor? So you should know a very important thing, that 2 points about mammillary body. So we have something called Pepys circuit. Pepys circuit. Pepys circuit is the one which is a part of our limbic system that controls our libido, memory, emotions, etc., etc. Right? So it has got amygdala, which is very important to control our libido, right? The sexual drive. And mammillary bodies are the ones which control our memory. So where do you get a hemorrhagic infarction of these mammillary bodies, doctor? Hemorrhagic infarction typically in thiamine deficiency, whenever there is any beriberi, right? We get Korsakoff psychosis, right? Korsakoff's, Wernicke-Korsakoff psychosis, right? So in Wernicke syndrome, where there is a memory loss, dementia, is all because of the hemorrhagic infarction of the mammillary bodies is what you need to basically remember. So today only take opportunity, doctor, examiner is interested to know about Pepys circuit is the favorite area of the examiner. So what is arcuate fasciculus? All the comprehension of the speech is there in the Wernicke's area, in the temporal lobe. All the motor output of our speech is synthesized in the Broca's area, which is an inferior frontal gyrus. Connecting the Broca's and the Wernicke's, you have arcuate fasciculus. Any involvement of that is called conduction aphasia, is what you have to remember. Superior rectal artery. What is the cause of the bleeding in case of the hemorrhoids, doctor? It is the superior rectal artery which is the source of the bleeding in hemorrhoids. Now, what are the structures that you see in superior mediastinum? Pulmonary trunk, thymus, arch of aorta. They're all the components of the superior mediastinum. So each mediastinum, agar aap liye to, middle mediastinum, superior mediastinum, posterior mediastinum, anterior mediastinum, you should know what are present in each of these mediastini. So once more, tell me, doctor, what are the 4 T's you remember when it comes to anterior mediastinal masses. So don't forget T, T, T or T. What are the 4 T's you are going to remember? T for thymoma. Sing along with me. T for teratoma. T for retrosternal thyroid. Retrosternal thyroid. T for terrible lymphoma. T for terrible lymphoma. The 4 T's you need to remember when it comes to the anterior mediastinal lesions is what you need to basically remember. So now, doctor, fallopian tube. Fallopian tube mein sperm should be rocked to reach the ovum. That's the reason it is ciliated columnar epithelium. Ciliated columnar epithelium. So you know pterion. Pterion is a landmark for the middle meningeal artery, right? So examiner gives an image-based question, making you to identify pterion is what you should remember. Then the tingling sensation, paresthesia on the medial side of the hand, typically indicates a ulnar nerve injury. So you know that the thumb, the middle finger, the index finger and half of the middle finger, the 3 are by median nerve, whereas the little finger and also the ring finger, they are by the ulnar nerve, is what you need to remember. Whatever, I'm so happy to see 12 online classmates. रोज मिलेंगे, रोज पढ़ेंगे, 22,000 PYQs को खत्म करेंगे. 22,000 कैसे हो गया? 10,000 PYQs of the NEETPG, 6,000 PYQs of the INICET, 6,000 PYQs of the FMGE. So 22,000 PYQs को खत्म करेंगे 150 hours में. और every Saturday and Friday एक subject wise mock test लेंगे according to a schedule and have a live discussion, solve it. And every Sunday full scale grand test and live discussion. Bus, you are the winner of the entrance exam. So now doctor, 6 months मुरली भारद्वाज के साथ सफर करो और lifelong you will enjoy your dream branch where you become the specialist. Now, musculocutaneous nerve. So what does it supply? Musculocutaneous supplies the biceps brachii. Supinator muscle is supplied by the radial nerve. You should remember. So examiner shown a image-based question basically of the biceps brachii and asked, do you know that musculocutaneous supplies it or not? So image-based questions are very easy to crack if you know the funda. So ulnar nerve. So once more, ulnar nerve, typically dorsal and palmar interosseae are supplied by the ulnar nerve. So image of the interosseae had been given and the examiner asked, what is the nerve that supplies it? That is the ulnar nerve is what you need to remember. So whenever there is a difficulty in the eversion of the foot and the loss of sensation on the dorsal aspect of the foot, typically what does it indicate? It indicates superficial peroneal nerve injury. Superficial peroneal nerve is in a very close relationship with the fibula. Any fibular neck fracture can cause the injury to the superficial peroneal nerve is what you need to basically remember. So whenever that gets affected, then the eversion of the foot is the one which gets affected is what you need to remember. So Shubham is asking, sir, NEET से पहले करना था, अब क्यों? Very good question. So remember, many people think before the NEETPG exam is the time to solve the PYQs. No, 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 no. When you start the NEETPG preparation, 22,000 PYQs को single liner format में along with the topic classified, I will give you as tweet books. 6,000 INICET, 6,000 FMGE, 10,000 NEETPG का, उसको सिंगल लाइनर बना के टॉपिक क्लासिफाई करके मैं देता हूं. Once you do this 22,000 PYQs फटाफट एक साथी के साथ बैठ के रिवीजन करे तो you don't need any other coaching program. Once this 150 hours you finish, you know what is the maximum destruction examiner can do, right? Then you need to quickly pick up those concepts where you are completely out of order. But ultimately, before exam, before NEETPG entrance, this 150 hours of revision is needed. At the start also, you require this 150 hours of 22,000 PYQs revision is required. Then you are ready to face the examiner. Provided every Friday, Saturday, you take a subject-wise mock test that I give you and participate in live discussion. Every Sunday, you take the full-scale grand test and participate in the discussion. You don't need any other coaching program, doctor. Now, going to the next topic, patellar tendon reflex. So, typically, patellar tendon reflex touches the quadriceps femoris. So, each of these jerks, ankle jerk, knee jerk, biceps, what is the root value? You should know, right? So, L3 is the one which you need to remember when it comes to knee jerk, is what you need to remember. Then absence of the pulse in the right popliteal fossa with a normal pulse of the left indicates what? So fundamentally, you have a common iliac artery, external iliac artery, internal iliac artery. That means if the common iliac artery is affected, both sides popliteal get affected, but only one side external iliac artery is blocked, then only that side popliteal artery get blocked. This is what you need to remember. So tomorrow, some of you become interventional cardiologists, interventional radiologists. So somebody who has got an intermittent claudication, peripheral vascular disease, atherosclerosis of the lower limb blood vessels, you pass a contrast, find the block, and then pass a stent and revascularize the patient. That's the reason you should know everything about this vascular tree. Now, posterior tibial artery has been shown in an image-based question and asked you to identify. So that's the reason you should know all the lower limb blood vessels as an image-based questions is a favorite area for the examiner. So at what vertebral level will the celiac artery forms from the abdominal aorta? From the T12 level is what you need to remember. So totally there are about 20 anatomical landmarks that you should know. So in my note, tweet note, where 70,000 high-yield facts are being given, right? I covered all these small kuti things that you need to remember when you go for the exam. So which is called the safety muscle of the tongue, which will not let the tongue fall back. Genioglossus is called the safety muscle of the tongue. And what is that? Ganglion that supplies the lacrimal glands. It is the pterygopalatine ganglion. So you should know otic ganglion, ciliary ganglion, pterygopalatine ganglion. What are the afferents? What are the efferents? Glossopharyngeal is associated with what? Facial nerve is associated with which ganglion? All this funda about the ganglia is a favorite area which you need to understand. So the pterygopalatine ganglion provides the parasympathetic secretomotor fibers to the lacrimal gland is what you need to remember. Now, internal carotid artery. So you should know what is the course of the internal carotid artery, what is carotid canal, what are the branches, anterocerebral artery, middle cerebral artery, similarly ophthalmic artery, which is the end branch of the internal carotid. Internal carotid does not give any branches in the neck, only external carotid gives the branches in the neck. So everything on the carotid branches, today only take opportunity to do the revision, doctor. Now, lateral pterygoid. So which muscle is responsible for the protrusion of the jaw, doctor? Protrusion of the jaw. So you should know protrusion of the jaw, it is the lateral pterygoid, which is the protruder of the jaw, protraction of the jaw. is what you should remember. And we all know middle meningeal artery. Middle meningeal artery is a branch of the maxillary artery. All the branches of the maxillary artery you should remember today only. So once more, if you go to the maxillary artery, doctor, first part, second part, third part of the maxillary artery, from each part, what are the branches that arise is the favorite area of the examiner. Now, doctor, tensor veli palatini. So your eustachian tube is opened by a muscle which is wrapping around it. What is that called? Tensor veli palatini, which is the one which opens the eustachian tube and maintains the patency of the eustachian tube is what you need to remember. So once more, embryologically, the genitourinary embryology is the favorite area of the examiner. Trigone of the bladder. Trigone of the bladder is derived from the distal part of the mesonephric duct. So mesonephric duct derivatives is a very important area to be remembered, doctor. Now, anterior superior iliac spine is a very important anatomical landmarks for a lot of structures, inguinal ligament, etc., etc. So, examiner has shown image of anterior iliac spine and asked you to identify that it is anterior iliac spine. Now, what is the highest point of the iliac crest? Iliac crest highest point is at the level of the L4. I told you, no, there are around 20 anatomical landmarks. बट्टी मारना पड़ेगा कल के NEETPG एग्जाम के लिए. Ductus arteriosus, typically from where does it derive? It is the 6th pharyngeal artery gives rise to ductus arteriosus. Right? So please remember this, one of the favorite question of the examiner. Each of the pharyngeal arches, what is their nerve? What are the muscles derived from it? What is the blood supply? What is the artery of each of these pharyngeal arches? Definitely every NEETPG exam only purely batti mare wala item hai. There is no intelligence required for this. But in the last moment, if you keep all these things pending, the whole thing becomes panic. So now only based on the PYQs, you need to develop a hunch and intuition, have your own personal notes to have the things to remember in the last moment, doctor. Spleen, from where does it develop? It develops from the dorsal mesogastrium. So ventral mesogastrium, dorsal mesogastrium, what are its derivatives? Embryologically, you should know. So each of these various mechanocepta, Pacinian corpuscles, free nerve endings, Meissner's corpuscles, everything. So which is that receptor that detects the rapid vibration sense? It is the Pacinian corpuscle which detects the rapid vibration sense. Once more, a repeated question. Posterior artery is felt between medial malleolus and the medial border of the tendocalcaneus in inversion is what you should remember. A baby at 9 to 10 months is the time where it develops the secondary curvature of the lumbar spine. ये ऐसा आइटम है, अगर मालूम नहीं है तो क्या गेस करेंगे एग्जाम हॉल में? That's the reason 22,000 PYQs not before exam. Now only your preparation should start and end with mastering the PYQs is what you should remember. Now, portal vein. Portal vein is because of the confluence of the splenic vein and mesenteric vein. So, you should identify the presence of the portal vein in the image-based question, which is the favorite area of the examiner. So, once more, superficial inguinal ring from the external oblique aponeurosis, then deep inguinal ring is a defect in transversalis fascia. So, inguinal canal anatomy is the favorite area. So, here I am mentioning which year of the FMGE exam this question has come and what is the topic it belongs and what is the item he has asked you to remember. This is how 22,000 PYQs of NEETPG 10,000, 6,000 INICET, 6,000 FMGE I'll give you as a PDF, right? Along with that, in 150 hours daily class, at least 100 to 150 PYQs I do the revision and finish in about 5 months of time. All right. So be with me every day, doctor. Now, what is anencephaly? It is a failure of the closure of the dorsal neuropore. Dorsal neuropore. I mean the rostral neuropore. Top mein. At the 25th day is the one that leads to the development of the anencephaly, which is due to the folate deficiency, which can be prevented by folic acid supplementation to the pregnant women antenatally, not only antenatally, prenatally also is what you need to remember. Now, fracture of the scaphoid is the most common fracture of the carpal bones in the wrist is what you need to remember. Then, whenever fracture of the scaphoid is there, where will you have tenderness, doctor? Typically in the anatomical snuff box, there is a tenderness in the fracture scaphoid. Pronata teres. The pronata teres is in a very close relation to median nerve passage. So there is a pronata teres syndrome where median nerve can get compressed is what you need to remember. So pronata teres arise from the medial epicondyle, not lateral. Medial epicondyle of the humerus is what you have to remember. Then hypothenar wasting and loss of sensation in the medial 1.5 little finger and the ring finger typically is the feature of ulnar nerve injury. Where is inferior scapular angle, doctor? 20 anatomical landmarks that you need to master, right? So you need to keep a quick list. So NEETPG exam is nothing to do with your intelligence, clinical experience. That's all blah blah. Or whether you got distinctions in MBBS, or you a very sincere student from first year, nothing matters. Did you finish the 22,000 PYQs? Did you identify what examiner is looking in the tomorrow's NEETPG? Did you fill those gaps where you are completely clean bowled? If you can do that, 4 to 5 months of preparation is must for clearing any medical licensing exam, doctor. The inferior scapular angle is at the level of the T8 is what you need to remember. So what is the function of pectoralis major? Flexion, adduction, medial rotation, medial, this is lateral rotation, this is medial rotation. Medial rotation of the arm, they're all the ones which are done by the pectoralis major is what you need to remember. Pectoralis major. Now, upper lateral cutaneous nerve. So, upper lateral cutaneous nerve is the branch of the axillary nerve. So, all the branches of the axillary nerve, today only we are going to do the revision. And once more, abduction. Abduction up to 90 degrees you require the deltoid. From 15 degrees to 90 degrees you require deltoid. So whenever axillary nerve injury is there, where will be the sensory loss, doctor? Regimental badge area. IPS, Indian Police Service, bolke regimental badge rehta na? In that area, typically there is a sensory loss whenever there is axillary nerve damage, and loss of abduction from 15 to 90 degrees is the problem with the axillary nerve injury is what you should remember. Now, doctor. Abduction of the hip joint. Abduction of the hip joint is by the gluteus medius muscle. Just before we studied, no? Right side gluteus medius and minimus will lead to the sinking of the pelvis onto the left side. Contralateral side, which is called Trendelenburg positivity. So it leads to abduction is what you should remember. Then testicular artery. Testicular artery is a branch of abdominal aorta. You should know all branches of the aorta and which anatomical level do they originate is a favorite MCQ, whether INICET, FMGE or the NEETPG exam. Killian's dehiscence is between the inferior constrictor muscle ke andar. Killian's dehiscence is what you typically see. Carotid gland, what are the secretomotor fibers come from? It is a glossopharyngeal nerve. Once more, otic ganglion, pterygopalatine ganglion, Gesserian ganglion, ciliary ganglion, all these parasympathetic ganglia. Examiner's favorite questions, which you have to be ready when you go to the exam mercilessly. Deep inguinal ring is a part of the transversalis fascia. Inguinal ligament is formed from the external oblique aponeurosis. Once more telling you, so many times examiner asked. Typically, if you see, 2019 FMGE में भी यही क्वेश्चन आया और once more 2019 में FMGE में the same deep inguinal ring के बारे में आया. That means inguinal canal is sitting in the examiner's question bank, which you need to reverse engineer to remember to do the revision. Now coming to carpal tunnel. Carpal tunnel में क्या nerve involved होता है? Median nerve. So flexor digitorum superficialis, flexor digitorum profundus, they are the muscles supplied by the median nerve which get affected whenever there is any carpal tunnel involvement. Then neural crest cell derivatives, neural crest cells, whenever they get migration, that migration of the neural crest cells is promoted by the hyaluronic acid, is what you need to remember. Now this ultimobranchial body, the parafollicular C cells in the thyroid, which release the calcitonin, they are derived from the ultimobranchial body, is what you need to remember. Then craniopharyngioma, it is a tumor of the Rathke's pouch. Rathke's pouch is what you have to understand. Coracoid process. So you should know different types of epiphysis. What is a atavistic epiphysis? Monkeys में है, chimpanzees में भी है, हमारे पास भी है. Coracoid process of the scapula is an example of a atavistic epiphysis, is what you have to remember. Ulnar nerve, how does it pass? Can the online students can punch? Is my voice loud and clear for all of you, doctor? Are the letters visible clearly? It is much better than sitting before a computer and drawing. It's impossible for me unless we are moving in the class. Then you will get a live class feeling. That should come. Ulnar nerve passes through the Guyon's canal. So carpal tunnel, Guyon's canal, all these छोटा मोटा canals के अंदर से, गुहाओं से ये नरु जो चलता है, वो गुहा का नाम क्या है, उस गुहा में कौन सा नरु जाता है, that is what you should know. Common perineal nerve is the one most commonly injured or damaged whenever the leg bones get broken, is what you have to remember. Femoral triangle base typically is formed by the inguinal ligament. Medial compartment of the thigh. What is the nerve supply of the entire medial compartment of thigh? Adductor, brevis, and everybody, you need to know it is the obturator nerve. First web space in the foot, it is supplied by the deep peroneal nerve, is what you need to remember. So in this context, Tina Goyal is asking, will this be available later? See, we have a web-based, because web में आपको पूरा बड़ा वीडियो देख सकते, लैपटॉप में, मोबाइल फोन में क्या देखते, कुछ भी नहीं देख सकते. So we will remove this video and upload it onto the web, and we give a small subscription fee for 6,000 rupees. We give a subscription, and there you can do a quick revision. There you can keep a high speed also and do revision. So 150 hours में 22,000 PYQs का revision is the package you will get when you subscribe to us, Dr. Tina Goyal. Right? Now, bronchopulmonary segment. So you should know pulmonary artery, pulmonary vein में, which is intersegmental. It is the pulmonary veins are intersegmental in the bronchopulmonary segments. So all the different bronchopulmonary segments, which is the one which is affected in the aspiration, and right lung, left lung ka kitne bronchopulmonary segments are there. All that you must be ready for the tomorrow's NEETPG exam, doctor. So once more, I like to take you to our, I like to quickly take you to our website, doctor. Today only, please go to playscore.live, playscore.live. So इसमें आपको 3 types of packages मिलेगा. One is video library. So all our daily live classes will be removed from the YouTube and then archived into this. Already there are 5,000 short videos covering 400 hours, covering all 20 subjects available for you. So this is made available for 6,000 rupees 1 year subscription. Similarly, NEETPG mock test is the second thing. Already you have a video library, you are overwhelmed with all that. Then you can take the NEETPG mock test. Every Sunday, one full-scale grand test along with live discussion. And every Friday and Saturday, there is a subject-wise mock test according to a schedule, and the live discussion will be offered. And that is for a period of 6 months, totally around 50 subject-wise mock tests and 25 full-scale grand tests. That is being offered for 6,000 rupees. Second is the notes. Notes में हम आपको PDF देंगे 70,000 high-yield facts in 20 subjects, 10,000 NEETPG PYQs of the last 10 years, and 6,000 FMGE PYQs of the last 10 years, and 6,000 INICET PYQs, and 5,000 clinical vignettes which are asked in the entrance, and 3,000 image-based clinical vignettes. So this entire package is being offered for 6,000 rupees, PDFs directly sent to your email, right? So this is what today only we have you have our helpline numbers, doctor, where you can give a call. So today only go to the playscore.live and take opportunity to subscribe to the various courses. Now coming back to our journey, doctor, left anterior descending artery, LAD. It is also called widow's artery because it is the most common artery to get occluded and lead to anterwall MI, where ventricular fibrillation is a risk and that lead to the mortality. That's the reason left anterior descending artery is the branch of the left coronary artery. Once more, right coronary artery, left coronary artery, what are its branches? What do they supply? Anterior 2/3 of the interventricular septum, posterior 1/3 of the interventricular septum. What is that? And what do you mean by coronary dominance? When do you call right or left coronary dominance? It depends upon from where is the posterior descending artery arising. If the posterior descending coronary artery, if it is originating from left circumflex, you call left dominant coronary circulation. If it is arising from the right coronary artery, you call it as right domination. So you should know everything about coronary anatomy, which is the favorite area of the examiner. और एक बार मैं आपको बताऊंगा, doctor, remember, posterior descending artery, PDA. PDA means public display of affection नहीं है. PDA means posterior descending coronary artery. From where is it originating is important. Is it originating from right coronary artery or is it originating from left circumflex artery is very important. Left circumflex is a branch of the left coronary. If it is originating from left circumflex, you call left dominating. Whenever it is originating from right coronary artery, you call right dominance of the coronary circulation. Everything depends on from where is the posterior descending artery is originating is what you have to basically remember, doctor. Now, duodenum, various parts. What is their length? Which is the longest part, shortest part? Where is ampulla of bladder opening? Everything you should know. Examiner gave an image-based question with showing you the third part of the duodenum. Can you identify it or not? Then what are thoughts of Billroth? Thymus, lymph node, spleen. Thymus, lymph node, spleen. These are the 3 structures. Histology, sure shot. in the tomorrow's NEETPG. Today only you need to go and do the revision. So the cords of Bildroth of the spleen are typically found in the red pulp is what you have to remember. Abducens nerve is the one that passes through the cavernous sinus. Once more, doctor. What are the tributaries of cavernous sinus? What are the nerves that are there along its bay? And what are the nerves passing through that? So cavernous sinus anatomy is a favorite area. So once more, 2018 FMGE mein hi nahi, it is also asked in many times in the NEETPG exam and INICET also. So what is the blood supply of the esophagus? Abdominal part of the esophagus is supplied by the left gastric artery. Left gastric artery is what you have to remember. Now, the various nuclei, the deep nuclei of the cerebellum, you need to know. So, fastigial nucleus is the most medially located nucleus in cerebellum. So, you have a emboliform nucleus, dentate nucleus, fastigial nucleus. Of all the nuclei, which is most medial, doctor? Fastigii is the most medially located nucleus in the cerebellum. मेरे यारो 2018 में पूछा गया cerebellar nuclei, but the cerebellar nuclei many times was asked in AIMS and also INICET and NEETPG. You have to be very sure today only. You should have 10 points to remember about cerebellum anatomy. That is how you need to be ready for the exam. So 22,000 PYQs. Every day हम एक 150 to 200 PYQs को master करेंगे. Another 150 hours में खत्म करेंगे. But that 150 to 200 should precipitate for you what I want to prepare, what examiner want to ask. To become a topper is very easy job, provided no panic, no running, that plan A, this plan B, this notes, that coaching, that batti maro, ye ratta maro, and all that. Oh, no, don't confuse. Shanti ke saath baito. Right? Burli Bharadwaj is your classmate, roommate, benchmate, tablemate. In the past 25 years, in South India, there was nobody who started coaching. North India, where Dr. Bhatia sir was even our teacher, much ahead of us. So that time, on the year when I prepared for entrance, I started a coaching program in a small school. Around 200-300 students used to come early morning while I myself was preparing for entrance. That year, I became topper. And in the first 100, there are 93 ranks our students got. Top 100. So that made us really kick. How is it possible? A bad student is a good teacher, right? So when you are preparing, never prepare alone. Have 2-3 sishyas, become that Ananda Swami, right? And then for their sake you prepare. Then automatically your preparation become organic, right? So you have Dr. Murli as your classmate, roommate, benchmate, tablemate every day to prepare with you and make you the best guy with 22,000 high yield facts, 50 full scale, 50 subject-wise mock tests, and 25 full-scale grand tests and discussion on every Sunday. This is all that you need to wrap up your preparation. Anything on the top of it is an extra, right? So good luck, and once more we will meet. रोज मिलेंगे, रोज पढ़ेंगे, एक दिन कामयाब होके दुनिया को बताएंगे, भाई मेरा रैंक आ गया, मेरा नंबर आ गया, right? Today one of the students said, sir, I got first position in the service quota. Wow, it's like I became a 5-star general because I could inspire somebody who left the medical college 10 years ago and still fighting for the exam. So that should be the spirit, doctor. Everything is nothing to do with the white matter, gray matter, or the brain. It is all adrenal, willpower to fight, to know, to read, to revise for the tomorrow's exam. Good night, and once more we will meet tomorrow. Don't forget to like this video, share this video, and also tell your friends that Dr. Murli Bharadwaj comes online on the YouTube every day and we will prepare together. Good night.